Good morning, everyone. Dr. Patmos again, and it is April 20th, and I'm just doing a quick follow up to the video I just did earlier this morning about influenza and COVID immunization nationally and among healthcare workers. And in doing the research for that, it became apparent that whether or not hospitals mandate is a big driver of the vaccination rate. So the hospitals that do mandate influenza vaccination get much higher, basically, twice the uptake of vaccination. And the same is true for COVID, although most hospitals no longer require COVID vaccination. They succumb to the um, political pressure from the anti-vaxxers with their disinformation and misinformation, and have suspended vaccine mandates. But it begs the question, why would a hospital mandate vaccination? What's in it for them? Well, if you look in the text below, there's good data and modeling that tells you exactly what a typical 500 bed hospital would save by mandating vaccination. And you can see that the economic argument, the financial argument, is a winner. There's a very strong return on investment. Hospitals know. I mean, one of the biggest costs and biggest hassles in running a hospital or any business is employee absenteeism. When employees call in sick because they've got the flu, it creates real staffing problems, and it makes it really difficult for hospitals to staff and do their work. They have to rely on agency staffing and temps, which cost a lot more. So hospitals know when their workers are out sick, it costs them money. You better believe the hospital CFO knows this inside and out. This is what they do every day. And so these vaccination programs in hospitals for influenza clearly reduce absenteeism. I mean, it's clear that the influenza immunization reduces your risk of getting influenza. If you do get influenza, it's a much milder illness. And so it reduces absenteeism and improves financial performance for the hospital. That's why they require. They require because there's an obvious financial benefit. The ROI is there. With influenza, with the COVID, the rate is of hospitals that require COVID vaccination is much lower. It used to be most hospitals did back in the first initial part of COVID, and then as the misinformation coming from fake experts really dominated, it really influenced people. And so resistance to mandatory vaccination soared. Robert Malone was especially important in generating that resistance with his national campaign that if there's risk, there must be choice, and against employer mandates and so forth. So the mandates went away. Now only 14% of hospitals in the United States require COVID vaccination. But even with that one, you can see that there is financial benefit. There's an ROI there. So now this ROI calculation just looks at absenteeism and the cost of absenteeism in the ROI. It doesn't include all the other things that happen. And I think one of the important points is it doesn't include the ethical consideration. Hospitals and hospital CEOs nowadays talk a lot about patient safety, about their commitment to patient safety. Well, there's nothing worse than going into, well, I don't say there's nothing worse, but one of the really bad things is when a patient goes into a hospital for an operation and they come out with influenza or come out with COVID. Yes, patients acquire respiratory infections in hospitals, including influenza and COVID, from healthcare workers who are sick and unvaccinated and coming to work sick. And, from a moral and ethical point of view, one of the things that no healthcare worker should do, no doctor or nurse should ever do, is infect your patients. Patients have the right to go to the hospital and not be infected by their caretakers, by their doctors and their nurses. And for that moral and ethical reason, physicians and nurses are obligated morally and ethically to be vaccinated. And that's why still 14% of hospitals require COVID vaccination, the smart ones, the ones with ethics. The others, have decided that it's politically not worth. They don't want to have employees angry or go on strike because they're misinformed about vaccines and they don't want to be vaccinated. So hospitals have largely given in to that, which puts patients at risk. Look, no vaccine is perfect, but flu vaccine is really good at preventing severe illness. It's about 50% effective at preventing you from getting influenza and reducing the spread of disease. So it is true that if you immunized all hospital workers, some would still get sick and some would still pass that on to patients, but it's reduced dramatically. The same thing is true for COVID. The COVID vaccine, there are breakthrough infections, even in the vaccinated, but there's no question the COVID vaccine prevents acquisition and transmission of the virus by 40, 50%, which is significant. The main thing it does is it prevents death and severe disease. So we need to do everything we can to protect patients. If you really truly believe in patient safety, then you need to do everything you can to protect patients. That means workers should be vaccinated and they should wear masks. They should practice infection control, practices and procedures and policies. Follow infection control procedures and policies, gown, glove, mask, and so forth. If they have any respiratory symptoms or work in a non-patient care area, if they have any respiratory symptoms, avoiding patients. We should do everything we can to protect patients if we really care about patient safety. So there's two really good reasons why hospitals mandate or should mandate. One, it pays for itself over and over and over again. It's got a very strong ROI. And two, it's the right thing to do from an ethical and moral point of view. The fact that hospitals, most hospitals now are not requiring these vaccinations, and most Americans are not getting vaccinated, is just proof positive of how impactful the anti-vax movement and the fake experts of the anti-vax movement have become. They are so good at their communication strategy and pushing out disinformation that they have managed to convince half the country not to get vaccinated. And that's just testament to how effective these fake doctors are who don't have the real credentials. Amazing, amazing. Fake doctors are now running the show. Anyhow, um, I don't know if I were a hospital CEO with given the moral, ethical, and financial imperative, I would try to find a way to educate my hospital staff. I think I would begin with a education campaign to try to reduce the number of people who are misinformed. And then once you get to the point where you have a sufficient level of education among the hospital staff, then maybe you can move toward, more uh, influential vaccination policies. What's fascinating is that uh, hospitals, um, the vaccination, you shouldn't have to really mandate. This is something that people should do voluntarily, but there's no question that mandates are really effective at increasing uptake. When you have mandates, you get twice the uptake of vaccinations. So that's why mandates are great. They get people vaccinated. That saves the hospital money, reduces absenteeism, and it honors the ethical obligation not to make your patients sick. Come on, man.